It is our honor to be joined by Dr. Abdullah Rahman Chattah with the country as postgraduate researcher in orthopedics in the UK and also the journey towards achieving the membership of the Royal College of Surgeons. Good evening, sir.
Hi, good evening, boss. How are you?
Fine, sir. Actually, today's section is regarding the guidance about the pathway. How you prepare yourself for MRCS and how you come to know and what type of the thing the student can have to do and how to understand the exam structure and eligibility and how to prepare and the challenges specific to international students and their career opportunities regarding the post MRCS like that.
Right. So, first of all, my name is Dr. Abdullah Rahman, and I'm working in University Hospital Birmingham, okay, in UK since 1 year. So, the thing is, first of all, I'm sorry, I wanted to make you guys a slide, PowerPoint slides, but I could not because I literally had no time. I could not find any time. But here you go. If you guys have any questions, you can like text me or anything. Um, well, what pathway that you guys need to follow is depending upon your personal circumstances, to be honest. So if you go for my choice, yeah, or my opinion, so I would say, first of all, you guys, if anyone is capable enough, and anyone is capable enough, to be honest. So if you guys want to go abroad or anything, first of all, you guys need to try for USMLE. Okay, this is the hierarchy. I would suggest, first of all, you need to go to uh, approach, you need to go for USMLE steps. Okay, trust me, this is not a very difficult exam. First of all, if you want to choose a pathway, go for steps. Okay, USMLE, it will take a little longer. It will cost you a much more than any other exam, but it's worth it. And the getting training over there is also very feasible, not that difficult at all. Even it's easier than UK. And number two, if you want to come to UK, which is comparatively getting a job in here is easier than UK because sorry in US. So how can you come here is like there are different pathways. So the one pathway which everybody knows is PLAB. Okay, you just need to appear in exams. You can do it while doing your house job, and you can appear in you just need an OET first of all, and then secondly you need to appear an exam on PLAB one, and then PLAB two, which is conducted in UK. For PLAB two, you have to come to UK. So the other pathway is this membership pathway. So membership includes like MRCS, MRCP, MRCOG. Every specialty has membership exams. So there's the normally what people do is that they do PLAB because it's easier than membership exams, obviously. So they come here, they find jobs somehow, and they come here in the UK, and then they after that you need to if you need to progress in life, if you want to like become a registrar, or if you would like to get an CCT means training, FCPS. So if you want to get in CCT, you need to clear your membership exams. Either it's MRCS, MRCP, MRCOG, then you can go for FRCS, and etc. So to be honest, I can understand that this is really very complicated matter. So I'm gonna just tell you uh, that one pathway is PLAB. Okay, you will come here, you can get the job. Number one. Number two is the membership pathways. So why you should choose MRCS? Okay, so if you want to go into surgery, okay, surgery or surgical related fields, surgery and allied human surgery means general surgery, orthopedics, urology, or something like surgery allied. So for those fields, you should go for membership exam MRCS rather than going for PLAB, because once you get PLAB, you will get a GMC and job opportunity here, and if you go for membership exams, you will get a GMC as well. Okay, so when you get a GMC, so if you have done membership exams. Okay, so your job opportunity over here is much better than PLAB. Other than that, which membership exam you want to choose, it's up to you, obviously. MRCS has a benefit over other MRCOG, MRCP, other membership exams is that both they are like two steps only. Other membership exams have three steps. So like they like MRCP one, MRCP two, then MRCP three. So membership and MRCS has only two steps. So two steps means MRCS A, which contains two exams. Basically, it consists of three exams, but they have compacted into two. So MRCS A, which includes two papers, parts of exam, and once you are done with MRCS A and B, after that you can do OET. OET is not mandatory to give that exam. Neither is house job. Uh, the only thing that you would need is your degree. Eligible to give the exam, no matter you have done house job or not, no matter if you have done OET or not. So once you get GMC after completing your MRCS A, B, and then OET and applying GMC, and then you can search for jobs in UK in any field. To be honest, it's not just that you can only apply for surgical fields only, but still, the chances of getting job in MRCS like they're much better than PLAB, simple PLAB. So that's how you can come over here. There's some other path. There are so many other pathways as well. One is exchange program called MTI, which I opted, but this will be more complicated for you guys to understand. So I would say, yeah, if you want to come to UK, you should go for membership exams. Okay, MRCS, MRCP, or everything. So there's a one drawback of MRCS. There's a big drawback, which is that unlike MRCP, MRCS is not a consultant degree. You need to know this very importantly. Like if you do MRCP, you can be a consultant. Okay, like if you have done MRCP, you have done FCPS or anything else. If you have not done anything else, and if you have completed your MRCP degree, you are consultant in. But if you have done MRCS, you definitely have a good future chances in UK. But this will add on into your CV that you have done MRCS and your GMC registered and blah blah blah. But you are not a consultant. But in UK, if you've done MRCS, you come here, and then if you want to do FRCS, so for FRCS, MRCS is mandatory. You need an MRCS. MRCS is like the first step. So you done MRCS, then you come here, and then you try to get an induction to try to enroll yourself in FRCS. So this is like for those people who are more inclined towards surgery and surgical allied. So they should go for it. So, any other questions you have? Sorry, this is a little complicated, I know, but you guys have any questions? You can ask me. I will try my best to answer them.
Yes, thank you so much for all that thing. It isn't this time. So, can you make a general statement from them, like what is a pass route and how does it is vary between the local and international candidates?
It's gonna be the same for for Indian, for Nepali, for Bangladesh, or for Pakistani. Thing is, it's the same procedure for everybody. Either you're in Pakistan, India, Nepal, or Bangladesh. It's the same. I mean, it doesn't matter if you're from Pakistan or India or from anywhere. It's the same procedure for everybody.
And so, for applying for the MRCS, the students have to clear their license exam of their own country first, like that.
I believe so because you need a degree. So as far as I'm sure for so there are some countries like Bulgaria. I'm sure those students do not even need to give GMC exams, PLAB or anything. They're directly GMC registered. So, but I think you guys have to clear your license exam in your home country to be eligible to give an exam, because you won't have a degree for to apply. You need to have a valid degree. So you need to have this your primary what do you say license exam to be cleared. But for steps, I'm sure for USMLE, you do not need to clear your home country exams. You can apply for exam for USMLE.
What is the structure of MRCS Part A and Part B? And is there any time limit between passing time A and appearing for Part B?
No, you can appear in MRCS A anytime you want to. For B, you can apply for B anytime that suits you, like even after a month or so, or like anytime. But less than 7 years, you have once you clear your MRCS A, you have 7 years of window. You need to clear your exam in within 7 years. Otherwise, it will be nullified. But obviously, you guys will do it. So you can do it after like 6 months, 8 months, 10 months, a year, whatever suits you. So yeah, you can do it anytime. There's no window that if you have done MRCS A, then you have 2 year, 1 year, 2 year, 3 year of experience, then you can apply for B now. It's not that case. You can apply for B anytime after your MRCS A.
Let's say, what are the best study resources for MRC Part A and B, like books, courses, and websites?
Yeah, so for MRCS A, once you guys will be preparing for your license exams, you guys will have a good hold of your fresh hold of your knowledge. For your background knowledge will be very fresh because you guys will be preparing for that. So I would recommend, as soon as you guys are appearing for your license exam, just appear for these exams as well, because for MRCS A, I would say the 50 to 60% of the course is based on basic knowledge. Okay, like anatomy, physiology, pathology. So the 50% exam is the basic. Okay, so that if you guys are preparing for your license exams, you guys will have a good knowledge already. So as soon as you apply for A, so your 50% of the exam will be helped by your licensing exams preparation, and for the other part of the exam, that would be a little difficult for you guys because you won't be having any experience in surgery or in clinical. So that exam would be a little difficult for you guys, but still, no need to be worried about that thing at all. You just need to. There's an there's a website called EMRCS. Okay, so this website contains around 2,500 MCQs with explanation, with topics, and yeah, I think 2,500 MCQs. Yeah, so with explanation and with topics. So you guys just need to prepare that website, okay? And other than that, there's like few past repeated MCQs. There are like folders. You'll be able to find it on online or through the Facebook groups or anywhere. So there would be like recent past exams. There are recalls. Sorry, there's recall exams. You can just read those exams, those MCQs, and then there's a one thing called FOSIA sheets. So that's it. But basically, the 70% of the preparation is from EMRCS, the online website. This is called EMRCS. So that's it for this. I think these are the things that which I did only. Uh, Other than that, there are like books obviously available. If you guys want to be 100% sure that what you guys to clear the exam, like there is Snell review anatomy for anatomy, and then there's like other things for physiology, etc. But I would recommend stay to EMRCS website. Just study that website thoroughly. All the explanation, you should know all the explanations, you should know all the topics in it. And then there's like FOSIA sheets, and then there's like recalls, and you just need to memorize those things as A B C D E F G H. Okay, so there will be a very high chances for you to get this exam cleared, and plus you guys would be just preparing for your license exam. You guys will have good knowledge of the basics, so this will help as well. For MRCS B, I would say it needs a, about 5 to 6 months of preparation. But if I'm going to tell you anything about MRCS B right now, you won't understand at all because obviously it's too soon to tell you that. One step, at a time. So for B, I mean, if you guys need any help, you can text me. I can guide you regarding MRCS A as well because I'm sure that these are no slides. You can't take screenshots and you won't understand. Doing training in like FCPS, then you will be more than good with 4 months. But if you are not doing your training and it will be like 5 to 6 months of preparation. So that's it.
From your personal preparations, I want to ask some questions. Like, do you recommend joining a study group or online courses?
So for A, for MRSSB, you definitely need a study group, okay? Uh, because it's more clinical and more examinations, history taking, communication skills. So in MRCSB, there's like major portion of those things. So you need a person to do an examination with, to take a history and for the communication. So for the 50% of the exam of MRCSB, you do need a person. You definitely need a person. So for MRCS A, I didn't do it in group studies, but everybody have their own personal choices. Okay, so some people do much better when they're doing in group studies. uh, so everybody has their personal choice. I had very less time while I was preparing for this exam. I think I had only 2 months, so there was nobody who was appearing in this exam at that time. So I knew 1 or 2%, but I was more comfortable studying it alone because I had to just memorize those things. So I was good to go by myself. But most of the people, they prefer doing group studies. So it's your personal choice. For MRCS A, you can have it, have a group chat, a group discussion or not. It's up to you. For B, you definitely need at least one person to prepare the exam.
And sir, what are the common pitfalls candidates should avoid and the mistakes the candidates should avoid during the preparations and all the things?
Yeah, so the thing is, what mistakes? Okay, so I think, well, I used to say that excess of knowledge is also dangerous. Okay, it's other way around to be honest, but I used to say that excess of knowledge is also dangerous for exam. Okay, how is that related? It is every exam that you guys will know. Every exam have its own pattern. Okay, like if you're doing your license exam, it has a typical pattern. Okay, so if you follow that typical pattern, you will definitely clear your exam. But if you literally divert from this pattern and you would like to, you would think that I will go for Gray's Anatomy book, I would go for Guyton, I would go for this book, for that book. So if you try to get a hold on all those bigger books, that is really very good for your personal learning. But if you need to clear your exam, those things are not really good enough because you will have a loads of data, but you won't have enough specific to the point knowledge which they will ask in exam. So basically, when you are doing your license exam, you need to follow a typical pathway, which I'm not sure about what that is. And if you're doing like FCPS part one, you need to follow a typical pathway, and then like for an exam, for every exam. So MRCS I would recommend just stay with the EMRCS, FOSIA sheets, recalls. These three things are the most important. And if you feel that you are weak in anatomy, so you can have your whatever book you studied for your license exam, just have a very superficial study for go through for that from that book. uh, so just do not try to grab your everything from everywhere, that you're studying for MRCS A, and you try to, you want to be very sure to pass it, and you will go to guide for the physiology path. You start studying Guyton, okay, or for your anatomy path you start going for Gray's Anatomy. No, just stick to the EMRCS plan. What topics are in EMRCS? Just elaborate those topics only. What questions have come in the past in recalls? Just go for those topics if you want to. So just stay in a bubble. Okay. So if you stay in that bubble of study, so you will definitely clearly get this exam pass, because what happens is some diseases, some situations are more important in UK, okay, because they're more endemic here, or there are more chances to have it in here rather than having it in Pakistan or in America, in US. So they normally will be focusing on those topics, and then those questions which are typically more important in the life of UK, not in US or in Pakistan. So what I would suggest is, whenever you're going to study, the whichever person who has cleared those exams is guiding you to just follow this and this. Just stay and stick to that point, not to anything else.
So, and what are the specific challenges internationals can they face in MRCS or in UK?
Once you are here, okay, once you have entered, once you are GMs registered, there's no challenge, okay? There's no matter what your background is, from where did you come, it does not matter. Once you are registered, nobody would even ask you from where did you graduate, or anything, okay? Or even if your job, for applying for job, no one would be caring enough that where did you graduate from. So the only hurdle you guys will be having is your license exam, because this will take a lot of time for you guys. And then after this exam, you will be like, more or less, you will be like thinking to settle down already, to practice already. So I would, this is the hurdle. Otherwise, once you are here, there's no challenge basically. So yeah, if you have a GMC registration through MRCS or through any mean, your CV will be very strong in Middle East, that you are GM registered and you have membership exam, MRCS, MRCP, whatever. So you will have a better opportunity in having securing a job in Middle East. Plus, there's better pay packages for those people who are GMs registered and who have cleared their membership exams. Yeah, so definitely.
The last and very important question, like it's a very common, how do you register for MRC exam as an international candidate?
Yeah, it's just a website. You just need to go to the website, which is called Royal College of Surgeons. So there are like four colleges: Royal College of Surgeons of Edinburgh, England, Glasgow, and Northern Ireland. So these are like four colleges. All four of them conduct exams. So for all those colleges, MRCS A, they have the same date of exam. They have same question papers. They are equally, you know, there's no differentiation between those colleges, that which is more, qualitative, or which is more prior to other one. Now they are same, all four of them. It's just that from any college you can get MRCS A, and for B, I think in Pakistan it's Edinburgh, Royal College of Surgeons of Edinburgh, which conducts exam in Pakistan, and in India I think it's three of them are conducting exams in India, as well as in Nepal and everywhere else, which conducts MRCS B. So those colleges have websites. Just type Royal College of Surgeons of whatever you choose, Edinburgh, England, Glasgow, or Northern Ireland. So it doesn't matter. You just put a search bar and then just need to make an account over there and then apply for exam. After applying the exam, they will ask you to send your degree, your I think identification documents, and that's it.
And sir, what are the basic documents we have to need for registration?
Your licensing, if first of all, it's your degree, and then it's a licensing body. Then, other than that, you have, I think, some basic documents. I think maybe ID card, maybe that's it. And those needs to be attested by one of the GM's registered person.
And sir, how will be it will be cost effective? Like if we compare the USMLE and a PLAB, the USMLE have it more budget as compared to PLAB. Seems like how much is a cost effective for the students?
So USML is definitely very expensive because once you're done your USMLE 1, then USMLE 2, that won't be very expensive, but their study materials like UWorld, it's expensive as well. And then after doing your USMLE 1, 2, you need to go for electives to the states. So for those electives, you need to have a hefty amount to do the electives. Then there are chances that you will get the training over there, which is, again, I'm repeating, which is really very worth it. First of all, USML is gonna be a little expensive, and then for PLAB. PLAB is not that much expensive, to be honest. I mean, from your for PLAB, you need OET first. Then for OET, PLAB 1, PLAB 2 coming here, and then all of this expenses are not too much, but still, yeah, they're much. So for MRCS, as MRCS, so it will be a little cost effective because you don't have to come to UK to give your exit exam for so you can give your this will save you a little amount of not coming to UK, your visa fee, your ticket fee, your expenses in UK that you'll be spending for a month at least. And then there's a lot of pressure to come here, there's reallocation problems comes up when you come here, and then you studying as well, and it will be very difficult for you guys, for anybody.
Yes, sir, thank you so much. It is our honor to be joined by our Dr. Abdullah Rahman Chattah with the country of postgraduate researcher in orthopedics in the UK, and also the journey towards achieving the membership of the Royal College of Surgeons. Thank you so much, sir, for your incredibly insightful.
No worries, anytime. I'm I would say I'm sorry I couldn't prepare any slides for you guys, but if you have any query, you can just ask me away anytime. And thank you so much for having me. Okay, take care.
Thank you so much, sir.